Adolescent healthcare is one of the major issues affecting public policy currently. Adolescents don't have an option to seek healthcare unless they are um, consented by a legal guardian or parent, which absolutely makes sense, but it's not always ideal when it comes to dealing with this age group because they are starting to make their own decisions and realize that they want to be involved in their own care but are not always sure on how to approach the situation. So this presentation will discuss how this can be changed in a way that is both effective for the patient, the parent, and the healthcare provider. Um, we will discuss the access adolescents or teenagers have to healthcare, the barriers they currently face. Obviously, one of the biggest problems in general when it comes to healthcare is cost. So looking into how this majorly affects the level of care adolescents get without parental consent or insurance coverage. Prevention. Um, we're going to look into understanding how early individual or seeking care for this age group will allow them to move forward in life and continue preventive care, which is very important, and outcomes to seeking care and allowing younger age groups to have independent healthcare abilities that they currently don't always have. We're going to start with access. Adolescents receive healthcare just like any other child or minor. Typically acute care and preventive care when it comes to yearly physicals. They get treatment for colds, viruses, common illness, and obviously vaccinations, which is part of preventive care, and any care that has to do with any early onset of a chronic illness or life-threatening illness. However, healthcare an adolescent receives is subjective to whatever the parent reports to the pediatrician or doctor. Adolescents are in an age group that is very private and often a part of activities that they partake in activities that might not be appropriate, and therefore parents are not aware of. And these children are afraid to share or embarrassed to share, don't know the outcome of it, to share these conversations with their healthcare providers. So not sharing this information can cause severe problems down the line in their healthcare. Aside from looking for more privacy, this age group is not always aware or most welcoming to interacting when it comes to answering questions, which cause office visits to be a little unproductive at times, not always. Understanding that adolescents need their own voice and should be more educated on ways they can receive care and can help that age group is essentially a big public issue that should be currently addressed. One of the biggest problems teenagers face currently is sexually transmitted diseases and early pregnancies. In the United States, nearly 7% of females aged 15 to 19 years of age become pregnant annually. And 20% of these births are repeat births, which means that this is not the first time these young girls have become pregnant and not known how to prevent it, just because of the lack of education or the lack of information offered to them within their healthcare provider's office or the home. Teenagers also face a lot of barriers. They don't understand that they also are protected under privacy laws, that there is information they can discuss privately with their healthcare providers, and this leads them to not seek care. They also don't know that there is access which again is private and free of consent, especially when looking at preventive cares when it comes to pregnancies or any kind of contraceptive. Healthcare providers are obligated to keep any information given to them private, unless it's obviously endangering the child's life to a certain extent where parent has to be involved, which should be the case. The biggest issue being that these children don't have the information and the education needed to be able to seek help if they are uncomfortable doing it in the home. Another barrier, which becomes a huge barrier, is cost. As a teenager, especially an early teenager, money is not available. All healthcare costs typically go through the parent via insurance or private pay, Medicaid, and these children are not aware that there is other options. Several states offer programs such as family planning, which covers any kind of contraceptive service for both male and females. And they are available to these children as long as they know where to go and how to sign up. Very minimal information is required in order for them to be active and approved for the program. Being able to sign up for this would alleviate the cost of seeking healthcare and also provide them with tools to prevent sexually transmitted diseases and pregnancy. Another big aspect of allowing teenagers or adolescents to have some access to healthcare on their own, to make that decision of moving forward and taking a little bit more ownership of it, which is something that they are highly interested in, is that it allows them to build a relationship and work with their healthcare providers individually at an early age. There's evidence that shows how one of the biggest barriers is communication, and if they start working on this issue at a young age, they are more subjective to having this relationship later on in life and understanding how important their healthcare really is to them and to the healthcare providers. And continuing on that topic, we move into why is it so important to change this policy. Taking the opportunity to allow young teenagers to start focusing on their healthcare and building this relationship with their healthcare providers will again create this sense of identity and will allow them to later on in life be compliant. Healthcare is a field that is very unique because you either have compliant or non-compliant patients. Typically compliant patients have not always been around healthcare and have not needed many services and do not understand the importance of primary care and preventive care. Seeking preventive care allows you to stop offsets of chronic illness, to catch all this stuff early on in its stages, so it can be prevented or even stopped at a certain level. Early detection of illnesses such as cancer can be so helpful. The earlier you find it, the easier it is to put in remission and beat potentially, because care can be provided immediately. So educating our young adults and children into understanding the possibilities that we currently have and looking to change what we already have into opening the doors for both children or young adults and their healthcare providers to have these open door conversations, to engage them in their care and the preventiveness of understanding how important it is to take care of themselves and understand their health care and the risks that are out there, would have immense possibilities in the future for possibly containing illnesses that are transmitted sexually by significant amounts. Below are my references. Thank you